I'm Dr. David Mitchell, and I've got with me today Lindey Hill. She's our COO at Mitchell Dental Clinic. And when Scheduling Institute announced that they were going to have a Leader of the Year, MVP type award, I thought of Lindey right off the bat because she does so much for us, and a lot of our growth over the last few years I attribute directly to her leadership. And so I wanted this to be a celebration of Lindey's accomplishments. And hopefully this is kind of like the Academy Awards where the nomination is, something to be proud of. I know there's some type of financial something. I don't know if it's a ride on SpaceX or $10. But anyway, we're doing this to celebrate Lindey and hopefully to use this video as a little training tool for the rest of our staff and our leadership team as an example of if you get super focused and get some specialized knowledge, what a difference you can make in an organization. So Lindey, thanks for being with me here today. So Mitchell Dental 2.0, I attribute a lot of our growth to your leadership and your journey through the U and everything you've learned and brought to us. So talk a little bit about, since we rededicated to coaching, what have you changed or learned, or how's that worked out?
Before the U, I was in an office manager type position, and so I had some leadership roles, and what I kind of saw myself doing is I just was doing all of it. I wanted it done right. I wanted it done the right way, which really was my way, not necessarily the right way. So I wasn't really doing 100% of anything because I had so many little things going on. So with the leadership and going to the U and finding out, I was able to kind of delegate some of that to my team, which happens to be leaders. So I was kind of able to get a little bit off of my plate and do my skill set, what I'm good at, and what can profit the clinic a little bit more, and also that leadership team.
I certainly agree with that. And one of the things that I've noticed about you is you don't wait for me to have to tell you what's going on. So you're analyzing what's happening and where you can be the most effective. And so talk a little bit about, how do you do that? I mean, what do you do to figure out where I need to be today?
Well, one of the things, and probably anybody in the 3 clinics will tell you, I'm very proactive. I worry about today, but I'm continually thinking about tomorrow. So I try to just have that mindset about what am I going to be able to accomplish that's going to be the best value for the clinic in the long run. One of the things that I was able to do by this leadership team is I was able to step out of Ackerman because that's where I was primarily at. Now I'm able to spend some time with the clinics, at least one day a week in all the clinics. So I'm able to talk with the leadership team, figure out, where do you need me? Do you need me to maybe help do some training? Do I need to maybe just do some role play, work, where am I best needed? And I don't have to worry about the day-to-day patient care because I've got this awesome team working underneath me that have awesome teams working underneath them. So I was able to kind of step away from that. And even just listen a little bit more. Sometimes they're not actually saying something to me specifically, but by listening to what's going on, I kind of know where I'm supposed to be. I've heard a lot with Scheduling Institute about clinical duplication, and that even trickled down to me. I found somebody in our main office, Ackerman, which is our largest office, and I've done that. Joanna is our overall team leader there, and now I don't even have to worry about the day-to-day things happening.
Yeah. And so one of the ways that I felt like you helped me the most was, and I didn't give you this job, but kind of doctor liaison. And so, like if I'm having trouble with one of the doctors, getting through to them, you've stepped up and talked to them and had some great breakthroughs with the doctor. So how did that come about?
Well, I was kind of struggling with it, and I know me and you had talked a couple times. And, the assistant teams kept coming to me, so I was frustrated. So I just finally, thought, okay, I've got to kind of eat this frog, lots of books and lots of things on that, and I just had to take care of it. And once I was talking with the doctor, because I was kind of intimidated, it was just me and her sitting there, and I was able to kind of listen to her and get some feedback. And I have to tell you, I was kind of proud of myself that I was able to accomplish something. But now I have this relationship with her that has just grown into something that's comfortable And, so I feel like I can go to her a little bit more. It has kind of built my confidence up maybe for the next doctor or for the next situation that I have to handle.
Yeah. I just wanted to celebrate Lindey. Thanks for watching our video, and we'll catch you next time. Thanks. Bye.